Hi, I'm Caitlin Kite with Dare County Public Relations Department. Today, I'm here at the vaccine clinic taking place in Kelderville Hills, where over 600 individuals are receiving their second dose of the Moderna vaccine. As we walk through the clinic, you'll meet several staff members who are working the front lines of the pandemic to keep our Dare County residents safe. You'll also get an idea of what the vaccination process looks like. First, let's touch base with Sheila Davies, the Director of our Department of Health and Human Services. What has been the general response from Dare County during this pandemic?
Regarding the vaccine clinic, the response has been overwhelmingly positive. People are so incredibly grateful. They're grateful, one, to be receiving the vaccination, but they're also really grateful for the process we have. They talk about how easy it is to register, and when they get the appointment, how smoothly it runs here. There's no waiting, you're in and out, you're not having to stand in the cold to wait to get in the building. So the response has been extraordinary, and that's in large part to the phenomenal team that we have running the clinics.
What are some of the most common questions you hear when people come in for the first time?
Some folks come in and we ask how they're doing, right? And they'll say that they're really nervous. And just taking a couple minutes and talking to them can really help. We've also gotten the questions of, okay, what are the side effects? And so we do have a fact sheet that we give them. We'll go over that with them, and then oftentimes I just refer them to the nurse, and I have them talk to the nurse about any medical questions that they may have.
James, if you wouldn't mind, kind of break down what you're doing here at the vaccine clinic and what your role is.
Once people are registered and checked in, I hand them a wait number. They go and have a seat in our waiting area. They fill out a little bit of brief paperwork. And then one of our administrative people takes them back to the nurses to have their shot administered. And then they follow up next steps with a COVID vaccination card. Then they wait 15 minutes and they're out the door.
Did you have a hand in helping to lay out this process and what this vaccine clinic would look like?
Part of our role with emergency management is try to coordinate some of that interdisciplinary coordination. So we help make sure that the EMS unit is here on time, ready to go. We help make sure we have our sheriff's deputy out front. We work with you all in public relations a lot to try to make sure the message that's going out is clear and consistent.
I'm here with Marge Whitley, and we are here where folks are coming in and they're coming to you to get their consent form.
We call them in numerical order. We just check the forms to make sure that the information is there because we have to file everything that is done today into the CVMS system for the state of North Carolina. Helps us get our vaccine for the next week. We also check for insurance information. We do file for the injection fee if they have insurance. If they don't, it's not a problem because there will be no charge to anyone for this.
Great.
And then once we go over the paperwork, we take the individual to the nurse so that they can get their shot.
I'm here with Jodie Wyatt, and she's here at the clinic administering the vaccines. We have her on a quick little break to ask her a few questions. So, Jodie, thanks for sitting down with us.
Absolutely.
What would you say to someone who's afraid of getting the vaccine when they come to you to kind of ease their minds?
To ease their minds.
Yeah.
I have had the vaccine myself. I've gotten my first and second dose. The first dose, a little arm soreness. The second dose, I was a little lethargic the next day, but not nearly as complicated as the disease itself seems to be for some people. It's such a risky thing not to get the vaccine, especially in that 65 and over population, or if you're a younger person who's around someone 65 and older, it's such a risk for them, and their results are not always get the disease and get better. There's a lot of hospitalizations and a lot of deaths that we've seen. So really this is just, it's really kind of, I felt like my responsibility to our community, to the worldwide community, to follow through with this and protect as many people as I personally can.
We are now at the vaccine card station, and I'm here with Brook Knight. So we're just going to talk to you a little bit about what you're doing here today.
After the individuals get their vaccines, they come up here with the papers that the nurses give them. We give them their actual vaccine record. If it's their first dose, we let them know about their second appointment and when to come back. If it's their final one, we just kind of congratulate them and remind them to keep the card. And then we send them to wait for 15 minutes to make sure they don't have a reaction, and then they can leave. So we're like the last pit stop.
Dan, if you wouldn't mind, tell me a little bit about what you guys are doing here at the vaccine clinic, what your role is.
Well, EMS is here kind of as a safety net, just in case there's a medical emergency, we're close by. But we're also functioning in different capacities as well, supporting the clinic here by helping out wherever needed. That might mean disinfecting clipboards, stuffing the clipboards, moving some chairs around, and helping people out with mobility issues, getting to and from their vehicles.
Well, thank you very much for being here and
You're
for taking the
welcome.
time to speak
Glad
with
to
us.
be here.
Appreciate it.